Hello everyone, my name is Patrick Adam F. Cruz from BSN 1B, living in Quezon Province, Lucena City. Today, I will demonstrating to all of you the bed making occupied. First, what is bed making? Bed making is a technique of preparing different types of beds for patient that is suitable for his or her position for a particular condition, a process of making neat and clean from the client. Second, what is the occupied bed making? It is made when patient is not able to tolerate or not permitted to get out of the bed. In short, it has the patient on it. Third, what is the purpose of occupied bed making? First is to keep patient clean and comfortable. Second, to promote health and well-being. Third, to conserve patient's energy and maintain current health status. Next, there is some special consideration that we must remember. Before starting the procedure, see to it that all linen is on hand and make sure that it is arranged orderly. If the bed is on high-low type, adjust the height accordingly to prevent having injuries. And finish one side of the bed one at a time. And of course, we must apply the principle of body mechanics when performing the bed making to prevent some back pain or injuries. Next is, here are some of the materials or equipments that we will be needing in making a bed making. Bottom sheet, top sheet, blanket, cotton draw sheet, pillowcase, hamper, and of course our PPE, the gloves, and our alcohol. Good evening.
Good evening.
So hi, good evening. My name is Patrick Adam F. Cruz from St. Anne College, Lucena City, and I will be your nurse for tonight. So tonight, I am here to change all the linens for you to have a comfortable and good bed. Is that okay for you?
Yes.
So before we start, let me ask you something. What is your name, age, and of course, your date of birth?
Denise T. Angara, 19, December 28, 2002.
Okay, so your name is Miss Denise Angara. So nice to meet you, Miss Denise. So before I begin to change all the linens on your bed, I will gather all the new linens, okay? So, but for now, I will just provide some privacy for you, okay? Now I'm done introducing my name to my patient, verifying the identity of the patient, making some consent from the patient, and of course, providing some privacy from the patient and explaining the procedure for my patient. I'm now going to gather all the linens. Now I already gather all the linens and make sure that it is arranged accordingly and orderly to save time and effort. Now, of course, do not make sure to do not touch to your uniform, the all linens, to avoid some contamination of microorganisms. Now, put all the linens on the clean surface of the room. We're going now to assess the patient or ask some question to the patient if she is okay or not. Hi ma'am, so I already gathered all the linens and may I know if you're okay?
Yes.
How are you feeling right now?
Okay lang ang puro ko kung nararamdaman ko.
You can barely move your body now.
Namumove ko naman po. Kaya naman po.
Okay, so now you can barely move your body and you're fine. Let's begin the procedure of bed making. Okay?
Okay po.
Let's begin to proceed our bed making procedure. So before we make the procedure in bed making, we need to make sure that we raise the bed from the appropriate height position. It helps to prevent some muscle strain and injuries from the health provider. Likewise, we need to lower the side rails of the bed, leaving the opposite side up to prevent some accident or injuries from the patient. And of course, don't forget to lock all the wheels to prevent some accident as well. Now I'm already raise and load the bed of the patient and the rails of the bed of the patients. I'm now going to grab the back blanket and put on the top of the patient. So ma'am, I'm going to put this back blanket to the top, okay?
Okay po.
And make sure to unfold the back blanket, and of course, make sure to encourage the patient to participate to promote some independence. Now I'm already unfold the back blanket onto my patient. Now I'm going to remove the top linens or the top soiled linens. Always remember to encourage the patient to participate. Ma'am, can you please hold this back blanket so that I can remove your top linens, soiled top linens. Now remove the soiled top linens by rolling it. The top soiled linens inwards towards the edge of the mattress. By rolling it, it can prevent some harbor or scattering or secretion of the microorganisms. Now, I totally remove the top linen soiled and make sure to do not touch it to your uniform to prevent some contamination of microorganisms. And of course, dispose it to the hamper. And of course, do not shake this to prevent some scattering of secretion of microorganisms. Now, position the patient by using the three segments: the upper, the middle, and the lower section or segment of the body. Ma'am, I will now position you onto my side by using the three segment. And as a permission, can I move your head, your body, and your feet?
Yes.
Okay. So on my count, 1 to 3. Move your head, your body, and your feet, okay? Okay, ma'am. 1, 2, 3. Next 1, 3. And 1. Now I already positioned the patient onto my side by using the 3 segment or the 3 section of the body. I will now instruct the patient to cross her legs or feet and position her arms to prepare for roll over on the side of the bed. Ma'am, can I touch your feet?
Yes.
Now I already position and instruct the patient to cross her legs and to position her arms. I will now transfer or draw the patient from the side of the bed on my cue. So ma'am, I will now transfer you to the side of the bed on my cue. 1, 2, 3. Okay? Okay. 1, 2. Always remember to provide the privacy for the dignity of the patient. Now, I already transferred the patient from the side of the bed. I'm now going to tuck the bottom linens and make sure in tucking the bottom linens, we roll it to prevent some secretion of scattering of microorganisms. And of course, you make sure to tuck in on the side of the patient. already tucked the bottom linens, we're now going to remove our gloves and of course apply the proper hand washing technique or the proper hand hygiene. Dispose the gloves and have a new one. Now I already perform a hand hygiene and of course I already put the new piece of gloves, grab the bottom linens and place under the foot of the bed or the table. Unfold it and tuck it later and create a miter corner. And now unfold the bottom linen. Now we already unfold the bottom linens. We are ready now to tuck and miter the corner of the bottom linens and tuck it under the mattress. By the way, mitering the corner will have an anchor position or anchor to the mattress. Always remember to have a wrinkle-free and have a fan fold to prevent some skin irritation. Apply the draw sheet. Put in the middle of the bottom linens and make fan fold and tuck it under the mattress. Now we already put the bottom linen and the draw sheet on the side of the bed. We're now going to the another side to untuck the bottom linens, the soiled bottom linens, and dispose to the hamper. So now, before we start to pull over the bottom linens and the draw sheet on the other side of the bed, and change or remove the soiled bottom linens, we need to position again the patient. So ma'am, I will now remove you from the center again of the bed. Okay, and I'm count of 3. 1, 2. Okay, make sure to always provide privacy from the patient. Now, we're going to transfer the patient from the clean side of the bed. Now I'm going to transfer the patient from the clean bed. So ma'am, I will now going to transfer from the clean bed on my count of 1, 2, 3. Okay? 1, 2, 3. Now I'm going to untuck the side of the bottom linens and make sure to untuck it by rolling to prevent some secretion of scattering of microorganisms. And remove the bottom linens of the other side or all in the bed. Now I'm going to dispose it to the hamper. Make sure to not touch to your clothes or uniform to prevent some contamination. And do not shake it from the spreading of microorganisms. Now, remove our gloves and of course, apply some proper hand hygiene. Now I already have the new pair of gloves. I will now pull over the new bottom linens on the other side. Tuck it under the mattress and tuck it under the mattress by using the miter corner. Now, in tucking the bottom linen on the under the mattress, you need to miter the fork. Make sure it is wrinkle-free. Now I'm done put overing the bottom linens and tuck it using the miter corner. I'm now going to pull over the draw sheet and tuck it under the mattress. Now I'm done pull overing the draw sheet and tuck it under the mattress. I'm now going to assist again the patient to position the patient on the center. Now, I'm done in covering your linens. Now I'm going to reposition you from the center again. On my count of 1, 2, 3. Always prevent or always make sure that the patient have the privacy. Now we're going to put the top linen on the top of the patient. Ma'am, I'm going now to put these top linens on the top. Okay? Now I already put the top linens on the top of the patient. These top linens will provide warmth and privacy from the patient. And we have the blanket here, and it is optional. We'll now loosen or remove the bath blanket onto his top. Make sure to participate the patient. Ma'am, can you please hold these top linens? Now by removing the bath blanket, we need to roll it inwards towards the edge of the mattress. Again, rolling the blanket inwards towards the edge of the mattress, it helps to prevent some secretion of microorganisms. Now I will totally remove the bath blanket on the patient. Make sure to do not touch it to your uniform to prevent some contamination of microorganisms and dispose it to the hamper.
Now tuck the top linens under the mattress by creating miter corner and have a toe fleet.
After that, we need to remove our gloves for it contains or it contaminates some microorganism from the bath blanket. And of course, apply the proper hand hygiene. Dispose the gloves. Now, in this case, it is okay that we don't use gloves to change the pillowcase of the patient. Now we need to change the pillowcase of the patient. Ma'am, can I hold your head to to get the pillow. Now remove the pillowcase. Make sure to do not shake the pillow, likewise to the pillowcase to prevent some contamination. Now, place the pillowcase on the hamper and place this pillow to the clean surface area. Now, before having a new pillowcase, we touch the contaminated pillowcase, we need to wash our hands or perform a proper hygiene again. Now, grab the pillowcase. Grabs the pillowcase at the edge and reverse it to grab the pillow. Now grab the pillow. As you can see, in this pillow, we have the open edge, and this open edge will far away from the door. Putting the pillowcase open edge pillowcase on the far away of the door, it creates a aesthetic bed maybe or bed. Now put this pillowcase. Since my door is here, I will put the open edge here, face here. Now ma'am, I'm going to put this pillowcase now, pillow in your head. So now I'm done doing the bed making from my patient. I'm now going to ask the patient if there is something that they need. So ma'am, how are you? How's your feeling today?
Okay lang po.
Okay, since you're okay, is there something that you need?
Wala pa naman po.
Okay, if there is something that you need, you can call me or the physicians or doctor, okay?
Okay po.
So now I'm done assessing my patient, and I'm going now to document and record or report some of the objectives or some observation on the bed making.